Hi, thanks for joining us again at the Nashville Fitness and Beauty Roundup. Today we have Angela Hicks, a licensed massage therapist at the Lactic Center. Thanks for being with us today,
Thank
Angela.
you for having me.
Let's just start off with a few of the basics about why most people come to you, I would assume, for muscle soreness, usually from exercise or maybe an injury, but I would say most of the time you get fairly health conscious people.
Correct.
Who
Absolutely.
are exercising or doing some sort of event, and they're just sore, achy, things hurt more as they get older, so they do the same thing they did 5 years ago, and all of a sudden, ouch, something's
Right.
out, something's hurting, or they're just sore.
Right, yes. This is actually a process called DOMS, delayed onset muscle soreness. And this happens usually within a 24 to 48 hour period after a workout. And research has indicated that the pain and muscle soreness we feel after a workout is actually not caused from lactic acid buildup, which most people think it is. So basically, research has indicated that this muscle soreness and injury is caused from minor tissue injury.
Minor tissue injury, so little tears in the muscle, microscopic
Yeah.
tears, and
Yeah.
that's just and that's normal with exercise. That's sort of a normal part of the process of getting stronger or building more endurance. Is it breaks down a little bit and then it heals.
Right. So basically what happens is when your body goes through excessive mechanical force, you have tiny microfibril tears in your muscle and connective tissue. So what happens is you create an inflammatory response. And once that inflammation occurs, your immune system is then triggered to kick in and repair. And what happens is during that repairing process, your musculoskeletal system then rebuilds and eventually gives you that beautiful muscle tone after several workouts later. So that's kind of the process that happens with delayed onset muscle soreness.
So does the massage therapy make that feel a little better temporarily, basically, in the
Yeah.
process? That's what you're
Yeah,
saying. Okay.
yeah, definitely. I mean, there are a couple factors included in that, but yes.
And the lactic acid you're saying is not usually, that usually gets blamed for that, really isn't the problem.
Right. So let me just explain to you a little bit about what lactic acid is. So most people think that lactic acid is a waste byproduct that lingers in the system.
Right.
But what happens is when you exercise, your skeletal muscles do release lactic acid. But when that's released, it transfers to the liver to be converted into glucose. And that process is gluconeogenesis. So from there, your liver, so basically what happens is your liver transfers this into sugar, which is created a fuel for your body, which is then transferred into energy to give you that power you need in your workout. So any unused lactic acid that's in your system is then pumped through the heart, deposited into the bloodstream, and then transported to the kidney to be eliminated out of your body. So this process happens within a 40 to 60 minute period. So anything after an hour after your workout, you really don't have lactic acid buildup.
Right. You've either burned it as fuel, it's recycled, or it's eliminated because it's a waste product and your body knows what to do with that.
Exactly. You don't need it anymore.
Okay. Okay. Is there anything people can do to prevent the painful effects of DOMS pre-workout or post-workout?
Yeah, so this is, there's not really any set preventative measure for delayed onset muscle soreness. However, there's a couple of things you can do to reduce that onset of muscle soreness. And one of the things that I really find is helpful is to incorporate a 5 to 10 minute warm-up period before your workout. And one of the things that I really encourage an athlete especially to do is this system called dynamic stretching. You're probably very familiar with it, correct?
Yeah.
So I'll just explain a little bit about what dynamic stretching is. It's basically a system of controlled muscle movements to loosen up your joints and loosen up your muscles. It also improves joint range of motion, increases heart rate and body temperature, and it also helps to reduce injury. Another thing that I think is very important in reducing symptoms of DOMS is to incorporate a 3 to 5 minute cool down period after your workout. This lowers your heart rate and brings your heart rate back to its normal resting heart rate state.
Okay.
And again, being a trainer like yourself, I'm pretty sure you probably encourage your athletes to go through a stretching routine, correct?
Yeah,
So
absolutely.
stretching is very important, and I think that stretching is the most important after a workout and after your cool down period when your heart rate is back to its normal resting state. So with that, I tell people to remember to stretch for at least 15 to 60 seconds. However, if you're one of those athletes who are wanting to increase flexibility, which some aren't, but some are,
Right.
if you want to achieve that flexibility, I suggest holding a stretch from 20 to 30 seconds or longer, probably no longer than 90 seconds. And what this does is it actually activates the brain to communicate with the muscles to release and elongate. And from there, you'll probably see the results in your flexibility that you're wanting to achieve.
Gotcha. The increased range of motion. And
Yeah,
so
absolutely.
the healing process still has to take place.
Yes.
But it's going to be a little less discomfort.
Right, and you definitely want to remember to stretch to the point of discomfort, not pain. So,
Gotcha.
yeah, so that's just
So
something
it's enough
to
where you feel like
remember.
it's stretching, it's doing something, but it doesn't need to be a
You
sharp
don't want to
pain.
tear the muscle fibers that you are working to rebuild.
Right.
Correct.
Well, speaking of tears, that takes me to the next question, which is, you always hear people hurt themselves because they move. They exercise, something's going to tear, something's going to hurt a little bit. And they want to know whether they put heat on it or cold on it. And I always get either an email, a text from somebody saying, oh my gosh, what should I do? What case would you recommend hot versus cold? Because this is a question a lot of people have.
That's a really good question, and that's probably one of the most common questions I get from all of my clients, whether you're an athlete or not. And I try to keep it simple. Okay, so hot increases blood flow, and cold decreases blood flow.
Sure.
Okay, so from a symptomatic standpoint, I always ask my clients these questions. If you're feeling, just to keep in tune with your body, if you're feeling like an achy, dull pain due to stiffness, limited range of motion, but not so much painful, heat is definitely good for something like that. So, however, though, if you're feeling symptoms like a sharp shooting pain, it hurts to move with extreme discomfort, you have inflammation or swelling or even heat in the area of concern, I definitely would stick to a cold compress. However, if this is injury related, if your pain is injury related and it lasts longer than a 24 to 48 hour period, I would definitely consult a doctor or physician because it could be a severe injury. So you definitely want to get that checked out.
Sure.
Yeah.
Sure, if it's lasting more than 24 to 48 hours.
Absolutely.
Right.
Yeah.
So inflammation would be from a more acute injury, and you want to reduce inflammation to help the healing process, and that's the cold.
Absolutely.
But are you saying otherwise, if it's just tightness, stiffness, you want to bring circulation there to help the muscle relax, loosen up, elongate, be able to give a little more to kind of work through that tightness is basically all it is. Or
definitely, and stiffness is the key without the sharp shooting pain. So that's definitely one of the keys to knowing when to use a hot compress.
Hot versus cold. Okay. Great. Thank you.
Thank you.
Well, we're going to be right back with another segment with Angela talking about different types of massage therapy for athletic, the muscle pain, soreness. We actually deep tissue versus a sports massage. So check back. Thanks.